Why does alcohol affect epilepsy and trigger seizures? Imagine a night out with friends where a few drinks seem harmless, but for someone with epilepsy, alcohol can be a tricky factor. Alcohol impacts the brain in ways that can influence seizure activity, but the effects are complex and depend on timing, amount, and individual health. When alcohol is first consumed, it temporarily enhances the activity of gamma-aminobutyric acid, which is the brain's main calming neurotransmitter. This can make the brain less excitable for a short time, which might seem helpful. But as the body metabolizes alcohol and blood alcohol levels decrease, the brain often becomes more excitable than before. This rebound effect increases the risk of seizures, especially in people with epilepsy. Most seizures related to alcohol don't happen while drinking but tend to occur within about 12 hours after stopping alcohol. This is because withdrawal effects and the brain's increased excitability during this period can lower the seizure threshold. The more alcohol someone drinks, especially if they have at least 7 standard drinks, the higher their risk of experiencing a seizure. People with certain types of epilepsy, like generalized genetic epilepsy, are especially vulnerable to alcohol-triggered seizures. Alcohol also interacts with anti-seizure medications, which are designed to control seizures. Drinking alcohol can make these medications less effective by changing how they are processed in the body. It can also increase side effects like drowsiness or dizziness, which can impair judgment and safety. Excessive alcohol use can lead to behaviors that further lower the seizure threshold, such as missing medication doses, poor sleep, dehydration, and irregular eating habits. All these factors can make seizures more likely. Chronic heavy drinking is linked to a higher risk of developing epilepsy over time. Long-term alcohol use can cause brain damage, head injuries, strokes, and metabolic problems, all of which can contribute to seizures. Withdrawal from prolonged alcohol use can also provoke seizures, especially if someone suddenly stops drinking after heavy use. In summary, alcohol affects epilepsy and can trigger seizures through several mechanisms. It initially suppresses brain activity but then causes a rebound increase in excitability after blood alcohol levels drop. It interacts with medications, reducing their effectiveness and increasing side effects. Alcohol-related lifestyle factors like missed medications, poor sleep, dehydration, and irregular meals also lower the seizure threshold. The risk is especially high for those with genetic forms of epilepsy and those who drink heavily or binge drink. Medical guidelines recommend that people with epilepsy limit or avoid alcohol, especially binge drinking, and always talk with their healthcare providers. This helps manage seizure risk and supports overall health and well-being. Remember, each person's experience is unique, so personalized medical advice is essential.